If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you. How are you out there? Welcome to another episode of Talking with Dr. Donna. I am your host, Dr. Donna White-Carey, and this is my show, Talking with Dr. Donna. As you know, my platform is all about building generational health. We talk a lot about generational wealth, but we do not talk a lot about how to build generational health. That means from where you are right now, starting with you, each individual person working to be emotionally and mentally healthier, spiritually healthier, physically healthier, and environmentally healthier. Why is that important? Well, when I think about my own personal history with health, my family history, I think about my father who passed away from multiple strokes. I think about my mother who had high blood pressure. I think about my maternal grandparents who had high blood pressure and strokes. And I think that for me, what type of health am I passing along to my children? I don't want to pass along that same type of health history of strokes, heart disease, of high blood pressure. So that is why we're talking about generational health. It's so important to start right now with where you are and to build from there. So that's what this show is about, building generational health, because we want to end this premature death that we have in our African American community. We want to end that right now, right here with this generation. So let's do what we can to kind of start that. This is YouTube. If you like what you see, please do subscribe to my channel and share it with others. Talking with Dr. Donna, share it with your family and your friends. And then let's also subscribe and then hit that little bell icon right next to the subscribe button. So every time I go live, which is every Thursday at 6:30 p.m. Pacific Standard Time, you have an appointment with your doctor. So subscribe and hit the bell to be notified. Tonight, we're going to talk about a couple of different things. And the first thing I want to just briefly touch on is to talk about coronavirus, where we are, and talk a little bit about what's been in the news all over. And I know you all know because you've been texting me, which is the pause on the Johnson & Johnson vaccine. But first, let's talk about coronavirus in general. The good news is that the number of cases is actually decreasing. So that's great news. We're seeing less people who are being infected with coronavirus. That's fantastic. That's what we want, particularly with the introduction of the vaccines. We want less cases. So we're getting that. But we are still seeing that the highest number of cases, it's still you 18 to 30-year-olds. You're still number one in the age group of the highest number of cases. Highest deaths, still though, in our elderly population. And in terms of ethnicity data, it's still the same. Blacks and Latinos are about 2 to 3 times higher rates of coronavirus than any other ethnic group. So we still have things to do. We still have work to do. In terms of one of the things that we have out there now that's available are the vaccines. Yay! Yay for the vaccines. I know there are lots of people out there who don't believe in vaccines in general and definitely are not interested in the vaccines for coronavirus. But let me tell you, if we did not have vaccines, we would still have difficulty with polio, measles, mumps, rubella, lots of diseases that killed people before the invention of vaccines. And now here we are with the coronavirus vaccine that is definitely decreasing the number of people who are dying from coronavirus. This week, there was a pause on one of the 3 vaccines. Now we have 3 vaccines. We have Pfizer, Moderna, and the Johnson & Johnson vaccine. This week, the Johnson & Johnson vaccine was put on pause. Doesn't mean that they're going to stop allowing us to have the vaccine or utilizing the vaccine. But what it does mean is that for now, they're investigating whether the vaccine is causing the blood clots that we've found. Now, personally, we've seen and documented across the country, across the world, over 70 million, that's 70 million doses of the Johnson & Johnson vaccine have been given. And the number of people that we've seen with these blood clots are 6. Okay, 70 million people vaccinated, 6 people with this severe, what we're calling perhaps association with the vaccine. And because we don't know if it's actually from the vaccine, they are putting a pause, smartly, rightly so, because the last thing we want to do is to have 7, 8, 9, 10 people with this potentially deadly complication from the vaccine. So I think it's important, and I'm glad that they're taking the pause on this vaccine, and we will see what they find. If you have received the vaccine, Johnson & Johnson vaccine, within the last 2 weeks, you should be paying attention to your body. If you start to develop headaches, if you start to develop leg pain or chest pain or difficulty breathing, you definitely want to go see a healthcare provider. The 6 people who had the blood clots, they found those blood clots occurred within those first 2 weeks. So if you've been past those 2 weeks, you're probably out of the woods from having this particular potential side effect from the vaccine. Also, most of them have been women. Most of them have been, actually all of them have been women, and all of them have been between the ages of 18 and 48. So those are sort of the demographics. Women between the ages of 18 and 48 who had the Johnson & Johnson vaccine within the last 2 weeks. So again, we're not quite sure if it has to do with the vaccine or perhaps something else. And so we are rightfully so taking a pause. Does that mean that everyone should take a pause from getting the vaccine if it's available to you? No, because like I said, we have 3 vaccines, right? And just like anything else, right? If there's a contamination of milk by Knudsen, hello, hey, in the Valley, by Knudsen or Berkeley Farms up here in the Bay Area, does that mean that you stop drinking milk? No, just means you don't buy milk from whatever company is having the issue. So same thing here with the vaccine. Just because this one vaccine is having difficulty doesn't mean that we're going to throw away all of the vaccines. We still have 2 vaccines, Moderna and Pfizer, that are still shown to be effective and not have shown to have any of these potential side effects. So if you have the opportunity to get a vaccine and get vaccinated, please do so. All right. Hi, I see you out there. I see you, Sharice. I see you, Judy. I see you, Gail, girlfriend. Thanks for watching. Share this page because we're going to talk about something extremely important tonight. That's all I wanted to say about coronavirus. It's still out there. It's still killing people. It's still important, but thankfully it is doing less damage. And that's exactly what we wanted to do with the vaccines. So encourage your families and your friends to think about getting the vaccine. It's a completely personal choice. But I'm encouraging everyone to think about it, really think about it for yourself, to talk it over with your doctor, to say whether or not it is a right for you to get the vaccine. We know what it does in terms of preventing hospitalizations and preventing death, but it may not be right for you. So talk it over with your healthcare provider before you make a decision. All right. So we are here in the month of April. April is Sexual Assault Awareness and Prevention Month. So we're going to spend a little bit of time talking about sexual assault and prevention. And I want you to be aware because I want to prevent sexual assault. I don't want you to have to be a survivor of this heinous type of assault. It is important, though, that we recognize that there are still assaults occurring, and especially during this time in the pandemic where people are just not quite themselves. They've been, maybe not taking medications because there haven't been an access with their provider. Maybe perhaps they're a little more agitated than normal because we have been cooped up in our homes. People are maybe a little bit more tense, a little more frustrated. When all these things start to happen, things that usually happen can happen more. As it gets lighter outside, as the weather gets better, as more people start to come out. Sometimes that means you might be out a little bit later because the sun goes down later. That means that you may take chances differently than you normally do because it's light outside. You may feel safer because it is lighter outside longer. But I want to make you aware, since this is April and this is the Sexual Assault Awareness and Prevention Month, we're going to spend the next 3 weeks here on Talking with Dr. Donna on making you aware of this type of assault, what type of resources that are available if you are a victim of this type of assault, how to protect yourself, how to advocate for you, and for those of us who are parents, how to advocate and protect our children. We know that it's happening to youth, it's happening to women, it's happening to men, and so it's happening to young boys and young girls. And so this is something that we really need to be aware of. The statistics that I read talks about 1 in every 6, I want to say 1 in every 6 women and 1 in every 10 men have reported that at some point they have been either coerced or pressured into having sex with someone that they didn't necessarily want to have sex with. Now, that is not assault because you're not physically harming them, but it is pressure. It is coercion, and it is something that we want to attempt to prevent. I'm looking down at my notes for my sexual assault. So it's 1 in 5 women, and about 21% of women and about 3% of men say that they have been sexually assaulted. Now, I think it's extremely important, and that's what you're going to hear when I bring in my guest next week, to talk about that this doesn't just affect women, but it also affects men. And a lot of us think that the sexual assault and prevention is just for our young girls. But let me tell you, there are a lot of predators out there, and this is for your young boys as well, your teenage boys and younger. So this is for everybody, okay? So I want to talk a little bit about just ways in which we can help to protect ourselves. Number 1 is to be aware, right? To be aware of your surroundings. I've taken quite a few, thanks Brother Kimbo, quite a few sexual assault classes. And one of the first things that they always teach you is to be aware of your surroundings. So to know where you're going, and to recognize who is around you. So as you're walking into a place, pay attention. As you're leaving and walking to your car, having things available to you that can help to protect you. So having your car, and so many of us have keyless entry. I know my car, I never take out my car key because it's keyless entry. But I do have keys like to my house, to the office. And so I carry the keys or the key ring in my hand as a potential weapon if I need to use it. You know, I'm from Tulare. I will use it. I will fight you back. So you want to have a weapon. So something on you that you can protect yourself. The other thing that I was taught, you can actually use your cell phone. So many of us have our cell phones with us all the time. And your cell phone actually, you can use the corner here. You can bop them in the head. You can hit them in the neck. You can do all sorts of things to help try to protect yourself from a potential assailant. The one thing that I can say is that it's best to teach your children from a professional how to protect themselves. So that is what we are going to talk about for this month of April. So let's look at what happens in terms of how frequently it's happening, okay? So every 73 seconds, it's amazing. 73 seconds, that's like every minute plus 13 seconds, an American is being sexually assaulted. Every 9 minutes, we see that that victim is a child. 73 seconds, an American is sexually assaulted, and every 9 minutes, that victim is a child. So again, this is why it's so important for us to be aware. This month is about awareness and helping you to know what you should be paying attention to. The next thing we want to talk about is, again, it's not just for women. 2.6% of U.S. men experience being raped in their lifetime. And 70% reported that that first experience occurred before they were 25 years old. Pay attention, okay? This is not just our women out here, it's also the men. That's why we're going to be talking about it. That's why it's important. 1 in 4 Black girls will be sexually abused before the age of 18. 1 in every 4. I mean, that's an alarming statistic. So I want you to make sure, again, this is why we're talking about it. And my guest towards the end of the month, Reverend Sarai and Deputy District Attorney Tiffany Gibson Chaplin are going to come, and they're going to talk about sexual trafficking in our young girls here in Oakland. And we're also going to talk about prevention and advocacy. So it's so important that this is a topic that we pay attention to. Other statistics that we need to pay attention to in terms of what we're doing with our sexual assault is thinking about 1 in 5 women in the U.S. reported completed or attempted rape at some point in their lifetime. 81% reporting that the first occurred prior to the age of 25. That's a lot. And I think that it's important for us to think about that. 1 in 5 women, and all of these, 70% in men, almost 81% in women, occurring before the age of 25. So that's why it's so important to talk to our young youth and young adults about this right now. And that doesn't mean that it doesn't happen when you're older, but I want you to understand the prevalence of it in our youth and our young adults. So again, for this month of April, we're going to be talking about sexual assault. We're going to talk about awareness. We're going to talk about prevention. We're going to talk about advocacy in all populations during this month. So stay tuned. I hope that you come back. I hope that you join me every Thursday at 6:30 as we go through this month of April and we talk about sexual assault and we become more aware and we talk about prevention. Okay. As usual, I want to give you some information about how and where you can get tested for coronavirus. So again, you can go to myturn.com. In order to get a vaccine appointment, you can call this phone number as well to get information and to get a vaccine, to find an appointment. There's many places that you can get an appointment here, vaccine in Alameda County. Right now, it's open to anyone who is 16 and over. And of course, if you're between the ages of 16 and 18, the only vaccine that's available to you is actually the Pfizer vaccine. The Moderna is 18 and over, and hopefully once the Johnson & Johnson vaccine comes back, it will be 18 and over as well. Okay. These are the ways, again, you can get an appointment. You can call myturn.com. You can do the phone number. You can go to COVID-19.acgov.org. and vaccines, get more information about the vaccines, get more information about how to find and schedule an appointment. All right, so short and sweet tonight because we have so much that we're going to talk about in this month. I wanted to make sure to give you some updates about coronavirus. I wanted to make sure to talk to you about what we're going to continue to talk about for this month of April with our sexual assault awareness and prevention month. And to just give you a little bit of information about the Johnson & Johnson vaccine to hopefully, for those of you who have not gotten your vaccine yet, that it will calm you and make you comfortable getting the vaccine. All right. Thank you so much again for watching another episode of Talking with Dr. Donna. Remember, you always have an appointment with your doctor every Thursday at 6:30 p.m. Pacific Standard Time. Make sure that you take care of yourself, that you pay attention, that you are aware, and make sure that you tune in to Talking with Dr. Donna for these next 2 weeks to really talk about sexual assault and prevention in all of our age groups. All right. Thank you again. Remember, take care of yourself, love your loved ones, hug your babies, and I will see you next week at 6:30 p.m. Take care. If you have a question for Dr. Donna, please do leave it on my page and I will be happy to answer the question for you.